Hello and welcome to the post-surgical seminar for robotic-assisted radical prostatectomy. My name is Jonathan. I'm one of the clinical nurse specialists for prostate. I'm joined by my colleagues Kate Hurst, assistant clinical psychologist, Chris Cottrell, patient advocate, and Audrey Gora, clinical nurse specialist for continence. In today's seminar, we shall discuss managing the emotional and psychological impact of surgery, a patient experience, and the role of exercise to recovery, your bladder after prostate surgery. The link to the vacuum pump device for penile rehabilitation will be sent separately. At the end of the presentation, you will be well informed about support available to you, be active participants in your recovery process, and be provided with information about follow-up care. Our approach is holistic, so please tell us what concerns you by filling in this form pictured below. We will send you a link to fill in your details, and we shall signpost you to the right people who can help you with your concerns. May I call on my colleague Kate Hurst for the management of the emotional and psychological impact of surgery.
Hi everyone, my name's Kate and I'm Macmillan Assistant Psychologist and I work as part of the psychology team at UCLH. And I'm here to talk to you today a bit about the emotional and psychological impact of having your prostate cancer and going through treatment. You would have received a lot of information about the physical impact and the practical impact of having your surgery, but maybe not so much on the psychological impact. So that is what I'm going to speak to you about today, as going through surgery for prostate cancer can be very traumatic and overwhelming, and that shouldn't be overlooked. So I'm going to start to talk to you today just about the different impacts that you could have found from having your surgery for prostate cancer on your day-to-day functioning. Firstly, the physical impacts of surgery. I'm sure you're all more than aware of these. Your sexual functioning and urinary issues could have been impacted quite severely from having your prostate surgery. And we have talks later on in this seminar from different professionals who will talk to you about managing the impact of both these side effects. Another physical impact that you could have found from surgery is fatigue. This is a really, really common impact of not only cancer, but also treatment and especially surgery. Fatigue is a feeling of extreme tiredness. You might feel weak, drained, lethargic, even when you feel like you're very well rested. And this is just a feeling that doesn't seem to go away, this feeling of extreme tiredness. Like I said, this is a really normal, common thing to feel. And I'm going to speak through a bit later about different ways which you can manage fatigue and improve this. Like I said before, going through your treatment for prostate cancer can really impact your emotional well-being and affect how you feel. I'm going to now talk through some common emotional reactions to surgery, which you could have been feeling all of them, you could have been feeling just a few of them, or none at all. It's really important to say that everyone's reaction psychologically to surgery can be very different. But it's just to say all of these are very common things that we hear from men who have been through this surgery for prostate cancer. Firstly, you might feel a sense of relief from receiving your diagnosis to making the decision to have surgery to then going on to having the procedure and coming back home. It might have felt like everything was very fast paced and you didn't really have much time to think about what was going on. But since you got back home, you actually are able to look back over what you've been through and you feel a sense of relief that you've got through it, and you can feel really proud of yourself and proud of your body for getting through that. But also with finishing treatment, it comes with perhaps more negative feelings of anxiety. You could be feeling anxious and worried about going back into hospital for further appointments, for your PSA test results. You might be worried about how successful the surgery was, and you could be fearful of the cancer coming back. You also might be feeling angry and frustrated. This is also really common in the recovery period. Your recovery might be taking a little bit longer than you expected. You might be very frustrated and angry with the side effects, especially the physical ones that I spoke about before that you're experiencing, because this can really disrupt your day-to-day routine and your life plans for the time being. You might be frustrated with having to If you have urinary incontinence, you might be frustrated with having to remember to bring a pad with you out day to day, thinking about where the next toilet's going to be and things like that. It can be really frustrating. You might be feeling a sense of embarrassment or ashamed, perhaps, of the side effects that you're experiencing, and you might find it quite difficult to speak about these problems with other people because they're quite personal things that are happening to you, so you might be feeling too embarrassed to share that. But I'm going to speak through a bit later about different options of ways you can talk about this to other people. You might be feeling very stressed. There's not only the initial stress of having a diagnosis of cancer and going through its treatment, it's also very stressful, the impact that this has had on your life. So it could be with your work or your finances. It could be stressful for your relationships or within your family. And this is very understandable that you could be feeling a heightened sense of stress at the moment. And in terms of your thinking, so all of these things, that these new physical impacts, emotional impacts that are going on, it can really impact the way that you think, and it can knock off your ability to think clearly. And you might find that you have been recently having perhaps a reduced concentration. So you might be finding that you're not able to focus as much on things that you used to find very easy to focus on, for example, reading the newspaper, reading a book, or watching a TV program. You might find that now your mind every so often just drifts off and thinks back perhaps to appointments that you've had or the surgery, information that you've been gathering. You might be thinking about that rather than being able to focus on the present. You might also be feeling worried. You worry about yourself, but you might also be worrying about your family members or loved ones, your partner, about perhaps the burden that you're having on them with them caring for you. You might also be thinking about your identity at the moment. So we hear this quite a lot in the psychology service, that when you've been through a traumatic surgery that has functional changes to your body because of it, you might have a sense of loss, and thinking about your identity, you might have lost a sense of your masculinity or your role in the family or as a partner. And yeah, it might just really impact on your identity. And memories and reminders. So we have this in here because a lot of people say that once they've received a diagnosis for cancer and been through treatment for it, they actually now are so much more aware of the word cancer coming up in the news or in magazines or advertisements. And you might just be much more aware now of the word cancer coming up. And even though this is really positive that there's more awareness and fundraising and research that's going into cancer and its treatments, it can also be quite a distressing trigger for you as well. So yeah, it's just to reiterate that everything I've been through here, it's not even all the emotional or psychological impacts that you might be experiencing, but the ones that I have spoken about are reasonable and understandable, and there's no right way to think or feel. Everyone is very individual with how they feel and how they deal with what they've been through. So I'm now going to talk through some coping mechanisms and ways you can perhaps manage these changes to your emotions and to you psychologically. You might have already found that you found your own way of coping, and that is completely fine. But these are just some advice and some support for you in case you're still finding your way through that. So firstly, it's so important to say that you need to give yourself time. You need to remember that you have been through something very traumatic and quite life-changing for the time being, and this can take a lot of time to recover from that. So don't put yourself under pressure to feel positive all the time. You just accept that you will have days where you're not feeling so great, but you'll get through them, and on the days that you are feeling well, just to make the most of them. Other ways in which you can feel that you can help with managing is relaxation. So once you've been through something stressful, it's very easy to forget about doing things that you enjoy, or perhaps remembering things that you used to find relaxing. So it's just really important to make sure you reincorporate these things back into your daily routine if possible. These could just be things like having a morning cup of tea in the garden, reading the newspaper, watching your favorite TV program. Just have a think about the things that you find relaxing and really try and put that back into your day-to-day routine if you can. And if you didn't have anything beforehand, maybe it's an opportunity to learn something relaxing. Could be meditation or mindfulness. And I've actually put in some resources on the next page with links of how you can access some YouTube videos if you wanted to try those out. Keeping active. So this is a really, really key one. Keeping physically active, doing some exercise. This can help with your fatigue if you do feel that you are struggling with fatigue as one of the physical side effects of your surgery. It can increase your energy levels, it can increase your mood, and can just generally help you feel better about yourself. And this can be done perhaps just out walking, try and increase the amount that you're walking. But if you're not able to get out and go on a walk, this can also be done in your own home. It can be walking up and down the stairs, sitting up and down from a chair. Cleaning is also counts as exercise. Anything that's just getting your heart rate up a bit more than it usually would, it would really, really help. And again, the resources in the next page, I've done some links of some workout videos and how to safely do exercise at home, which is from some NHS guidelines. So if you're interested in that, have a look on the next page. Another way in which you might find is helpful with coping is developing a routine. So this can even be advice as simple as make sure you're starting your day at the same time, incorporate things into your day which you know are most important to you. So this is really important if you are perhaps struggling with fatigue and you're feeling very tired, to make sure that you get things done that you really do want to get done that day. It would be a good idea to plan ahead and prioritize things. So perhaps if you want to make sure you go on a walk, make sure you plan that in at a time which you know you're feeling most energetic. Improving your sleep as well is really important. So if you make sure you're going to sleep at the same time, maybe perhaps have a bedtime routine, do something relaxing for a half hour or an hour before you go to bed, like reading. That can really help improve your sleep. We've also got on here distract yourself. So distracting yourself can be a short-term mechanism for reducing anxiety because it switches off the part of your brain that is linked to fear. So this can really help you feel more relaxed, more in the short term. So it could be doing puzzles, reading a book, cooking, doing colouring actually really does help as well, listening to music. And asking for support as well is a really, really key one. So you might feel comfortable asking a loved one for support, someone close to you, like a partner or a family member or a friend. But perhaps if you didn't feel comfortable asking someone close to you for support and talking to them about how you're feeling, you can use the healthcare professionals here at UCLH. They are still here to help you, even though you are now home recovering. So you can use the number for your clinical nurse specialist, and you can use their experience and expertise to answer any questions that you might have or concerns. Also, talking to men who have been through the same thing. So men with prostate cancer who have also been through this surgery or any sort of treatment for prostate cancer, actually talking to others who do actually know how you feel can be really, really valuable. And just knowing that you're not alone in what you're experiencing, any side effects, anything that you're feeling. We have a support group at UCLH, which did used to run in person, but they've now moved it to online. So it's now on Zoom, which is a video communication. So if you are interested in joining a prostate cancer support group, which is run by healthcare professionals at UCLH, you are very welcome to join that. And that runs every second Thursday of the month, 12:30 till 2. So I've got a number just at the end of these slides, which you can call, or an email address if you're interested in that, and you can get in contact and they can set you up if you did want to join that support group. These are the resources that I mentioned earlier, which you could find helpful. So there's the NHS guidelines for exercise, and then some different websites for exercise, which you could find helpful following, and then also some links for mindfulness and meditation. And there's a link there for the online community for Macmillan Cancer Support, which you can access, and a guide for dealing with the emotional impact of COVID-19 when you have cancer. And so onto the Macmillan Support and Information Service. So like I say, we have now moved to an online support. So we are still there for you, just even though it looks slightly different at the moment. And there is a Macmillan Support and Information Service helpline. So you can contact this helpline, which is just on that page there, or email them. Support and information specialists can help you with any practical concerns that you have or questions. They can offer a lot of advice and information, or just for emotional support if you needed someone to talk to. They are there, and you can use that number. And they are open Monday to Friday, 10 till 4 p.m. And yeah, and they can refer you on to other services we have at Macmillan, like the welfare and benefits advice, if you need any advice in terms of your finances or benefits that you might be entitled to. We've got complementary therapies, which is still running online, and also some face-to-face is still going ahead, which is things like massage and aromatherapy and reflexology. And of course, we have the psychological care team. So we have a team of clinical psychologists who are there to give one-to-one support if you did feel that you needed that. And you can talk to your clinical nurse specialist or your doctor if you wanted to think about making a referral to the psychology team. And Prostate Cancer UK is a really, really helpful charity. And if you want to look on their website, they've got a lot of information on all different types of treatment. There's an online forum on there, and they also have a helpline, a Prostate Cancer UK helpline, if you wanted to contact that instead of the Macmillan Support Information Service. Before I pass you on to Chris, who is a patient advocate who's going to talk through with you about how exercise has helped him through his cancer journey, I'm first going to tell you a bit about a research that has been done titled "The Effect of a Brief Physical Activity-Based Presentation by a Former Patient for Men Treated with Radical Prostatectomy for Prostate Cancer." And the results from this study showed that a brief one-off physical activity-based presentation for men with prostate cancer delivered by a former patient alongside cancer exercise specialist advice may result in a clinically significant benefits to quality of life and may influence physical activity intention in certain individuals. So this piece of research shows the positive effects that physical activity can have on a cancer patient. I'm now going to pass you over to Chris, who is a patient advocate, and he's going to talk through about how physical activity and exercise has really helped him through his cancer journey.
Hello, my name's Chris Cottrell. I was diagnosed with prostate cancer in 2011. I'd like to share with you some of my cancer journey and some of the things that have helped me through that journey, and also talk about some of my experiences post-surgery. So back in 2011, I was diagnosed with an aggressive form of prostate cancer. My PSA was 42 and my Gleason score was 9. Initially, I was told that the treatment options of surgery and radiotherapy weren't available to me, and that I was placed on hormone therapy. The hormone therapy brought my PSA down from 42 to 0.48. But I suffered from many of the side effects that you can get from hormone therapies. So the mood swings, the hot flushes, the fatigue, the muscle loss, and of course the loss of libido. It was actually a really difficult time for me. But about 9 months after going on hormone therapy, my PSA started rising, and the hormone therapy was no longer working as effectively as it did initially. And so I was advised to come off the hormone therapy and to have surgery. So I had my prostate out, I had both nerve bundles taken out, which control erectile function, and they had to remove both of them because of the extent of my cancer. And I had 28 lymph nodes removed. My surgeon had told me that before the surgery, that because of the extent of my cancer, it was likely that at some stage, even if my PSA was undetectable after the surgery, that at some stage it might well return. But I have to say I was really pleased when I got my PSA back 8 weeks after the surgery because it was indeed undetectable. So immediately after the surgery, I had a catheter in, and I was told that when the catheter came out, I was most likely going to be incontinent. But I don't think anything had really prepared me for what incontinence meant. So for me, when the catheter came out after 7 days, when I stood up, I just completely emptied my bladder with no control or no sensation. And every time I moved, I leaked. I started the pelvic floor exercises after the catheter came out. And I continued, and 5 weeks later, there was still no improvement at all. And I have to say, I was beginning to get a bit depressed about it. But then the following week, one Friday evening, I remember suddenly getting some sensation. And by Monday morning, I was completely dry. I've been carrying a pad in my bag for the last 8 years, and it's now well past its sell-by date. And in fact, I went skiing 3 months after the surgery, and I needed no protection whatsoever. Obviously, for everyone, you recover your continence at different stages, and some people are continent almost immediately after the surgery, and for others it takes longer. As I say, for me it was about 6 weeks. There's a lot of support available at UCLH, so if you are finding it difficult, please ask for help, and please persevere with those pelvic floor exercises. I continue to do them today, and they are important, and they are your friend for life. So as I mentioned, immediately after the surgery, my PSA was undetectable, but a routine blood test 9 months later indicated that my PSA was rising again and was actually doubling in a very short period of time, a matter of weeks. I was given a choice at that point of either going back on hormone therapy or going on a period of active surveillance, not having any treatment, but just watching the development of my PSA. And because I'd suffered so badly from the hormone therapy the first time round, and because I thought I didn't have very long to live because of the rapid doubling time, I chose the active surveillance. My consultant oncologist told me that he really advised me to go and get fit and referred me to a specialist exercise clinic. I followed his advice, but with a slight degree of trepidation because I'd never been to a gym in my life. I had no idea what to do, and I certainly had no idea what to wear. But I've done 3 things since then. So first thing is I set myself a step target, and I try to maintain that step target each day. Secondly, I do some aerobic or cardiovascular exercise. The NHS recommends that all adults, particularly for prostate cancer patients, that we try to do a minimum of 150 minutes of moderate cardiovascular or aerobic exercise a week. For me, this involves principally walking and brisk walking. So when I go out for a walk, I try to walk a little bit faster than I might normally have done, so that I get a bit out of breath, I raise my heart rate, and I do that 3 or 4 times a week. And then the third thing I do is some strength or resistance exercises. I did this under supervision in the specialist clinic, but now I do it at home. So I've got the basics, and I can do my strength exercises without any form of equipment at home, which obviously through COVID has been particularly helpful. So I maintained that, and in fact, I went through a period of 3 years on active surveillance, and then in 2016, a routine scan showed that quite a large tumour had returned to where my prostate had been in my prostate bed, and the tumour was into my bladder neck and also into my lymph system. So I was told I had no choice. I had to go back on hormone therapy. And I also had 18 weeks of chemotherapy and 7 weeks of radiotherapy. I exercised throughout all of this period, and actually that really helped me. And then again, after all that treatment, my PSA was undetectable. And then about 18 months ago, it started rising again. So I'm back on both first and second generation hormone therapies. The exercise has been really, really important to me, and it's helped me certainly minimize the side effects of the treatment. So the last 2 times that I've been on hormone therapy while I've been exercising, I've suffered from none of the side effects. And I think it's actually helped. It's helped me deal with the treatments and to be strong through that process. So for me, really, the exercise program that I continue to do has been absolutely life changing and life saving. Back in 2011, I was told that my cancer was terminal and I only had a few years to live. But as I say, with great support from the doctors and nurses, and also this exercise, I feel amazing today, and I wish you every success after your surgery in making rapid recovery. Thank you.
Thank you very much for your talk, Chris. I'm going to pass you on to my colleague, Audrey Gora, for the healthy bladder function.
Thank you, Jonathan.
My name is Audrey. I'm one of the continence nurses from University College Hospital in London. Today we're going to look at urinary incontinence after prostate surgery. In this presentation, we're going to look at a normal bladder function, what can happen to your bladder function after prostate removal, what can make your symptoms worse, and what can you do to help yourself improve, and lastly, how can you manage your leakage. We'll look at the bladder function overview. So the normal bladder, you find the bladder in the lower part of your abdomen, which is your belly, and it acts as a temporary store for urine once it has been made by the kidneys, and you get rid of it when it's convenient for you in the toilet. To hold the urine, the bladder muscle needs to stretch and stay relaxed, and the sphincter, which will be at the bottom, should always stay shut while your bladder is filling. So when you go to pass urine, the sphincter muscle needs to then relax to open up the urethra, and the bladder muscle will then squeeze the urine out to empty. So that's how the mechanism works. So if you look at this diagram, it's a diagram of the male anatomy. You'll notice that there is urethra, and you've got the bladder, you've got the prostate, which is shaded in reddish pinkish color, and just underneath the prostate you've got your band of pelvic floor muscle. So you can see that the pelvic floor muscle supports all our internal organs. So what keeps you dry before surgery? You've got a stable bladder function, and then you've got an internal sphincter, you've got urethral pressures from the prostate, you've also got an external sphincter, and then you've got pelvic floor muscles. But once you've had surgery, what you then start to rely on is a stable bladder function, and then you've got small amount of smooth muscle tone in the urethra area. So this is where then they would have removed the prostate, so you'd only be left with the smooth muscle tone around the urethra. You've also got the external sphincter and the pelvic floor muscle. What symptoms may occur after you've had your surgery? So after surgery, different people will experience different symptoms. So sometimes you will notice that you start having urinary frequency. You also experience urgency of urination. So this is a sudden need of wanting to wee without any warning. You start experiencing increased. You may start experiencing increased nighttime needs to empty your bladder, and sometimes you will notice that you will leak before you reach the toilet. Some people will notice urinary leakage on exercises, on any movement, coughing or laughing. Sometimes you might experience poor urinary flow, or you may be dry, which is good, so don't panic if you're dry. And sometimes you might start having erection difficulties. So what can make your symptoms worse? Once you start noticing the different urinary symptoms that you'll be getting, you need to start looking at how much fluid are you drinking. What time are you having these drinks? What type of fluids are you drinking? Are you anxious, or are you stressed about your recovery or about any situation? You also need to look at the medication that you be taking. Sometimes some of the side effects of the medication makes you want to pass urine more. So you need to look at if there's any change of your medication, and just make sure you are aware of the side effects. You also need to look at your age can have an impact, and whether you've got some pre-existing conditions, if you are diabetic, if you are carrying extra weight around your belly, that can also have an impact on your urinary symptoms. Whether you've got a chronic cough, people that are constantly coughing, that can also have an impact, especially on the stress urinary incontinence. Or if you suffer from constipation, if you're constipated, it's something that you need to make a note of and try and address, as these things can have an impact on your bladder emptying. So next we need to look at what can make your symptoms better. So you need to start thinking at how much fluid are you drinking, what are you eating. We normally say you should only drink probably 1.5 to 2 liters of fluids per day, and try not to cut down on your fluid intake also. So there should be a balance on your drinking, because if you are dehydrated, your urine gets concentrated, and then that can cause bladder irritation as well, because some people tend to stop drinking thinking that it makes their symptoms worse, but actually dehydration just makes your urine concentrated, and you will notice that you still continue to have your urinary symptoms. You need to look at what times are you drinking the fluids. So if you're somebody who is having problems during the night, you're getting up several times, you need to stop drinking 2 hours before you go to bed, and see if this will help your symptoms. Change what you drink. Try and avoid bladder irritants. And also you need to avoid drinking large volume of fluid in one go. So if you're drinking 500 to a liter in one go, that is quite a large volume to take, and you will end up going to the toilet in and out. If you are carrying extra weight around your belly, I think you might want to consider starting to lose weight, as this can have an impact on your bladder emptying. And also, if you're constipated, avoid getting constipated in the first place, and also avoid straining, as this can help. If you're somebody who smokes, you might want to consider stop smoking, as sometimes this can also have an impact. If you've got a chronic cough, try and find ways of to manage the chronic cough. And lastly, you need to start doing your pelvic floor exercises. So when you're looking at this diagram, there are fluids that cause bladder irritation. Tea, coffee, hot chocolate, in cola, or any other fizzy drinks, and also green tea. So these can make your symptoms of urgency and frequency worse, as they tend to relax the muscles in your pelvis and your urethra. So it's you need to look at that. So any citrus or fruit juices can also have an impact on your bladder, as they are acidic. Same with tomatoes. Any tomato-based soups or fresh tomatoes, because of the acidic, they can cause a bladder irritation. Any black currant juice, that can also have an impact on your bladder. So you just need to be aware of these drinks. And also some herbal teas, they have different properties. If you look at like elderflower, rose, wild blackberry, and nettle teas, they have a diuretic effect. It means you end up going to the toilet more, and this will increase your frequency and your urgency as well. So it's something that you need to consider. And lastly, alcohol. It increases the acidity in your urine, and start irritating your bladder. So try and avoid drinking this if you're having problems. Sometimes when you're having a glass of wine in the evening, that can have an impact also on your bladder. So sometimes you might say, I drink coffee or orange juice because it helps with my bowels. You might want to consider and try other alternatives to help with your bowels if these drinks are irritating your bladder. And then, if looking at this list, these are the fluids that don't irritate the bladder. So you can have milk, you can have water, you can have decaffeinated tea or coffee, or decaffeinated green tea. But sometimes we can also say you need to stop the decaf completely if your symptoms don't change. We also try non-citrus fruits juices like apple or mango. You can have diluted squash. You can have milkshakes. Just be careful with milkshakes because it's quite high in sugar, and you can add weight with that. And also try some herbal teas like chamomile, as they can help calm your bladder. There are two types of urinary incontinence that one can experience after prostate surgery. So the first one we're going to look at is a stress urinary incontinence. Sometimes we say SUI in short. It means involuntary leakage of urine during activity that increases abdominal pressure. This pressure pushes down on the bladder. For example, when you're coughing, or when you're laughing, when you're sneezing, or when you're lifting heavy things from the floor, running or walking. So if your sphincter is damaged or weak, this is when the urine starts leaking out when you start doing these activities. So you need to start doing pelvic floor exercises regularly so that you can improve these leakages. But sometimes it is difficult to always know you are doing the right thing. So the second leakage is associated with an urgency sensation. So you get a sudden desire to want to pass urine without any warning. So when you're getting that desire, you need to check, do you have a urine infection? If you've got a urine infection, it manifests itself with an urgency feeling and frequency and getting up at night. So is your urine burning, stinging, and smelly when you're passing it out? If that's the case, then you need to increase your fluid intake by maybe 500 to flush out the bacteria from the bladder for a day or two. If that doesn't improve your symptoms and you're starting to feel unwell and you're having a fever, then you need to contact your GP. Or if it's out of hours, you then need to attend A&E to see if you can get some antibiotics. If you've checked and you realize you don't have a urine infection, you need to look at what and when are you drinking. So what fluids are you drinking? What times are you drinking? So remember of the fluids that we talked about that can irritate the bladder. So if you're drinking so many cups of coffee or tea a day, that can have an impact on your bladder. So you now need to start thinking about changing your drinking habits and drinking fluids that don't irritate the bladder. So when you get an urgency sensation, what you need to try and do is to contract your pelvic floor muscle up to 10 times, like a flutter, when you get that urgency sensation. So the whole idea of doing this is to try and gain control over your bladder rather than you going to the toilet quite frequently because of this urgency sensation. You need to remind your bladder who is in charge. Find ways of distracting yourself when that urgency sensation comes. So you've been to the toilet, you know your bladder is empty, you've done a good volume, and then after a few minutes you feel the need that you want to wee again. This is whereby when you need to start distracting yourself. Sometimes you can try counting backwards numbers so that you get your mind focusing on the number rather than on the bladder. So like, for example, you start counting from 100, 99, 98, 97. So your mind starts thinking on the numbers. Or sometimes you can do the alphabet backwards. So you're now focusing on that rather than the bladder. After a few minutes, you'll notice that that sensation will disappear again. So the idea of doing this is to aim to increase the time between the toilet phases and allow your bladder to fill and expand. So as the bladder fills up, there are different sensations that you get. So don't just go to the toilet on the first sensation. Try to go to and pass urine when the bladder feels full. Yeah. And try not to go just in case. Because sometimes if you've had an accident in the past, what tends to happen is you want to try and avoid that from happening. As a result, you end up going in and out of the toilet so that you don't have an accident. But by doing that, you are not allowing the bladder to stretch and fill to its capacity, and sometimes that can cause a problem in the long run. We have got some information about bladder retraining. So what I've just described is retraining the bladder. So if you feel you need more information, just ask and we can give you some information or talk you through about it. We normally advise that you try to practice doing pelvic floor exercises. If you watched a surgical school seminar video, it might explain to you how to do this, but if you've not done it, it's fine. You can still start after you've had your prostate surgery. So once the catheter has been removed, this is the time that you need to start doing the pelvic floor exercises. Try and do them regularly by including them in your daily routine. So when you wake up in the morning, you might think, let me do my pelvic floor exercises before I have a shower. You can then, the next lot will be lunchtime, and then the next lot will be maybe when you're having your evening meal. So you kind of have a routine of when you do this to avoid you forgetting. So you kind of set reminders for yourself. You need to do an inward lift and squeeze around the urethra, which is your water pipe, and do not squeeze your belly or your buttocks when you're doing the pelvic floor exercises. Try not to overdo them, as the muscle will get tired and can ache and will give you the opposite effect of what we are looking for. So sometimes you might be sitting at home and you'll be thinking, right, let me do my pelvic floor exercises while I'm watching TV, and you're constantly squeezing your pelvic floor muscles. So this will lead to overworking the muscle. And what you then notice, like if you've done that in the morning, later in the afternoon, you're starting to leak more. It's just because you've done a lot in the morning. So this is why we say do them regularly. You also need to be patient when you're doing pelvic floor exercises. They do take time before you start noticing an improvement. Sometimes it can take up to 3 or more months before you notice change. So you need to be persistent and to continue doing them. You also need to keep a track by setting goals. So sometimes it's nice when you've set yourself goals and you've got a diary, or you're keeping a journal of your progress. And some people, they are quite technical, so you might want to use a mobile phone app. For example, there is an NHS squeezy for men that you can download on your phone. This can help you or work as a reminder to do the pelvic floor muscles. If you feel you're not doing them right, you can always ask for help. A reminder is also, don't stop even when you're dry. So don't stop doing the pelvic floor exercises even when you're dry. You will need to continue doing them so that you can maintain that strength that you'd have managed to get. So here are some tips for doing pelvic floor exercises. You need to find a comfortable position. You can do these pelvic floor exercises sitting, standing, or lying down. If you're sitting, notice how your chair is supporting you. And initially, it feels better. You can kind of feel your pelvic floor muscle moving when you start doing them sitting. And then once you gain your confidence in the muscle movement, you can then do them in different positions, sitting and standing. Because if you remember, you have to do your day to get on with your day-to-day activities. So it's also good to get used to doing them lying or standing. So while you're sitting, you also need to notice your breathing. Try not to hold your breath. Just do nice breathing in and out, and make sure your stomach and your buttock muscles, they stay relaxed. So you're not clenching your buttock muscles or your stomach muscles. And then concentrate on your pelvic floor, gently tightening and relaxing as you have been advised. Use the neck before lifting or any coughing. So when you cough, before you cough, you need to do that contraction so that it reduces the volume that you're going to leak. Or if you're going to lift something, before you do that lift, you need to contract your pelvic floor muscles, and then you lift something from the floor. So this will reduce the volume that you're going to leak, and it just helps to improve things. So it's about practicing the things that you never used to do. So you have to remember doing these things. You also need to work on your inner thigh muscles too by sitting comfortably in a chair. You place a ball like a football between your legs, just above your knees. You roll your knees inwards and push your heels apart. Lift your pelvic floor muscles up and in around your anus. Hold for a count of 10, then relax for a count of 10, letting your knees and your heels go down to their usual position. So repeat this 2 to 3 times a day for about 5 minutes each time. So that will help improve your pelvic floor muscle. There is also some extra help with the pelvic floor muscle training. You need to keep up general good habits, diet and exercising. If you need some extra help, you can try an electrical stimulation. It's generally not available on the NHS. So we've got the Innovo neuromuscular electrostimulation. So it comes in in pads, and it has got a short version as well if you prefer that. So it's part of, it helps you with your exercise. It's part of treatment, not management of stress urinary incontinence. It augments your pelvic floor exercises, and it's for external and easy to use at home. Remember, you have to self-purchase this product. So here are some products that will help you manage your urinary symptoms. We'll start with single-use pads. So these are the pads that you were given when you had your catheter removed. So you use them once they get wet and you throw them away. So they come in different shapes and sizes. These are available for purchase from pharmacies, any chemist, most of the supermarkets, or online. It just depends with how much you are leaking. And then you can buy different sizes. Sometimes you can get them from the community nursing service via GP referral. In some areas, you can self-refer. You need to check on their websites of your local CCG clinical commissioning group to see. We've also got washable products or reusable option pads. So they come in different shapes and sizes. You've got briefs and you've also got boxer shorts. It also depends with the volumes that you are leaking. Again, you need these ones, you need to self-purchase. So you can look at how much capacity each pad can hold, and then you use them and you wash them and dry them. Just remember, you do not iron these products. We've also got some external collection devices that you can use, and Afex support. It comes with jock straps or in boxer shorts. It has got a receptacle which is adhesive free and latex free, and stay dry interior wall. And then you've got the briefs for support and comfort. So that's when you can choose your shorts or your jock straps. And you've also got a collection bag, which is direct contact with the receptacle. So urine would drain into the bag, and once the bag is almost full, you can then empty the bag, and it can refill again. So this is an external device. It does not go inside of your body. it is available on prescription. So it's something that you'll need to ask your GP for it if you want to use this device. We have got urinary sheaths. It's like a condom catheter, some people say. It's self-adhesive and is worn on your penis, and you attach it to a leg bag like how it's shown in the diagram. And then when the bag is full, you can empty the bag. Just remember, before you use the urinary sheath, you need to make sure you measure your penis. You need to make sure that it's the right size, because if it's too small, it can restrict blood flow, so you don't want that to happen. Or if it's too big, it can fall off. So it's important to make sure you measure yourself correctly, or you ask somebody to measure for you. You can use urinary sheath for swimming or when you're going for walks, and you can then come and change it. So always another thing to remember is, before applying it, you need to make sure that your skin is dry, and also check on it every 24 hours. So don't keep it for more than 24 hours, as you need to check your skin and make sure that it's okay. We also have got penile clamps, or also known as compression devices. These are used for short episodes of vigorous activity, maybe when you're going to play golf or when you're going to dance. It is not recommended to use overnight, so it's for daytime use only, and you need to release the clamp every hour to 2 hours, or depending on the manufacturer's recommendations. But you do changing the positions where you've placed it, as they can be painful if it's put too tight as well. So the whole idea of using it is just to apply gentle pressure enough to close your urethra, and that's how it stops you from leaking. It also allows your bladder to fill if you are having continuous urinary leakage. So it's, when you're using it, it then allows your bladder to start holding urine, so it starts filling it, and then when you feel full, you can then go and empty. So these are only available for private purchases only. They are not a prescription item. And if it's something that you need to try, you need to ask your nurse for more information about these compression devices, as they are not suitable for everyone. So the one on the diagram is one of the compression devices or penile clamp that you can find. This is another example again that you can also find, which is out there on the market, and this one comes with 3 different sizes, and yeah, there's some of the things you can try. So you've been, a year has gone by, and you still feel like you are wet. There is a surgical option, and this can only be considered at least 1 year after your prostatectomy. So it's not something that would advise you to have 2 or 3 months or 6 months down the line after your prostate surgery. You will need to wait for at least a year after the initial prostatectomy surgery. So surgery is an option to help deal with the leakage if it is persistent. If you want to consider surgery, we need to do further investigation so that we can determine what is the cause of your urinary leakage. So we usually do a test called a urodynamics test. So it gives us quite a lot of information about how your bladder is behaving and what will be the best way or the best surgery that the doctors can also offer you. So here are some useful links that you can try and log on. Thank you so much. Hopefully you find this helpful.
That is the end of the post-surgical seminar. We thank you for taking the time, and we hope that we imparted something that could be useful for your recovery. Thank you.